on. Like when they don't know.
When they have no clue what's going on, right? Are they there, do they have a duty to act as a healthcare provider? They're being paid at this facility to take care of this person. Yes?
Yes.
So what is your role now? I mean, we go on these every single shift.
To be an advocate.
So what do? How do we approach that?
There's a care facility ombudsman you can call.
A what?
Ombudsman.
Wow. Okay, let's explain that, Andrew.
There's
President's at a dispensary?
a state-appointed representative of care facilities, and you can look up the ombudsman for Lane County and find out, and then you can call them if there's a nursing home or something like that that seems to be
Not meeting their.
Okay. Do you think it's isolated to the one patient?
No.
Do you think that is a global thing?
Uh-huh.
So what do they do when they have people, when they get to the point where they think they can't handle patients? What do?
They take more.
They send them to the ER. And what do they expect the ER to do?
Fix everything. Fix them.
No, just take them.
Take them and keep them overnight.
Yeah.
How many of them stay overnight?
None.
No.
None. Where do they end up? They end up going right back there, right? And so then what happens 3 hours later?
We bring it back.
We go right back again. So is that sustainable? Can we
No.
continue to do that in our profession? So this is where you have to do something, make an attempt and assist, try and assist the system to be like, hey, this is where a little coaching comes in with those care providers, right? So a lot of times we spend, obviously not like the video, but we'll take time and we'll talk to the care providers and we'll be like, listen, they're not gonna do anything for this person. This person simply needs to be taken care of here. There's no fix that the ER is going to provide.
Seriously? No?
How's that, Cody? You good?
No, I actually decided I don't want to on.
Oh, you
I
don't?
saw a tear fall from Chandler's eyes.
So you become a little bit of a social worker when it comes to talking and interacting with the institutions. Domestic elder abuse. What types are these?
Same as the institutional, but in a house.
But when we say, so if it's domestic, what type of people usually are the abusers?
Family.
Family, right? Normally, what was, heard it over here? Yeah, normally it's the kids. How many people usually are the unemployed kids that live with mom and dad and have nothing else to do? So they stay, live there, and so what do they do? All their frustrations and stuff, what do they do?
Take it out on mom and dad.
Take it out on mom and dad, right?
Especially like if it-
Especially what?
Like if they're relying on their parents to pay for everything, and then all of a sudden they're not anymore.
Right? And so, yeah, mom and dad cuts them off. So financial abuse, so how does that work? What do they do?
They get the power of attorney a lot of times and take everything, or take the, or they take the credit card, they take their social security checks.
They take their personal belongings, and they take their personal belongings and take it to the pawn shop and get money that way. And so you go to a call, right, for a welfare check, and you have a little old man who's in bed, his daughter's supposed to be caring for him, or son is supposed to be caring for him. You see the house is in just really, really poor condition, and he tells you that his child has been stealing his stuff and hawking it for money and hasn't been giving him his meds.
Red flag.
What do you do?
You're gonna have to document and report, because you're a mandatory reporter,
You guys remember who to report to?
DHS.
No, not for elder. Senior disabilities.
Yeah, there you go. Senior disabled services and disabilities. Okay. DHS is for the kids. Senior and disabled services is for the elders. Okay. All right. Among people dependent on their care. Yep. Really their relatives. Take a look at the bottom one here. Reluctant to give the information. Yes, Chad? Chad is-
Just careful with listening to exactly what people say about being abused. I've ran into patients that said one thing and they were so far out of it that it was not the reality.
Reality. Are we in reality right now?
Well, no, but take it with a grain of salt.
No, absolutely. You do that with every single patient that you talk to. The history that you get from them, the interaction. So that's why some of the FTEPs and some of the preceptors that are out there, when you walk through the door, they want you to ask 4 questions. They want you to, what's your name, what's your date of birth, where are you at, and who's the president, right? Yeah, really great way to start off an interaction with somebody. Drives me crazy. I finally told, because one of them had told my guy to do that, and I walked into a call with him and he did that. I'm like, I don't want to ever hear that come out of your mouth again. I was like, I want you to talk to a person like they're a normal human being, and if things aren't making sense, then you go down that route of, okay, where are we right now, right? And so that's when you start to go down that route. So absolutely, every single patient, you're doing that kind of LOC assessment to make sure that the information they're giving you is accurate, right? You go into a place and they say, hey, they haven't been taking care of me, they haven't been giving me baths, they haven't been helping me, they haven't been doing any of this stuff, but yet the house is immaculate. That's where you start to be like, okay, let me try some kind of roundabout questioning to see just where we're at with that
This
guy.
guy said his 10-year-old grandkid stole all this stuff and his grandkid was like 25, so.
So that's a quick and easy way to just, that's a check box. He's like, okay, yep, this guy's off his rocker, right? But then you're like, oh wait, that was that 25-year-old, but then he actually does have a 10-year-old, and then you're like, yeah, son of a gun. Gotta be good on that one. But the fear, why would they want to not pass the information on that they're not being treated right?
Because that's their caregiver, and they could retaliate when they're vulnerable.
Right. So like, what happens when you leave, right? Like you walk away, you leave them there.
What?
Yeah. Right. So the retaliation, it's usually a family member, so they don't want a family member getting in trouble.
Gilmore,
They don't want the
that's who it
family
is.
going to jail. They don't want any of that sort of thing. And then is it embarrassing to say that, hey, my kids beat me up, my kids don't take care of me?
Yeah.
Like, do you want to be that person that's like, hey, you know what? Yeah, like my family loves me, they take care of me, they're good, right? You don't want, they don't want to be that person that says, you know what? My life sucks right now. I'm miserable. They don't take care of me. And so a lot of times it's embarrassment that they won't report it. They don't take care of me. We talked about that. All right, taking care of them. Oh, here we go. Here's some of that abuse stuff, right? So, what kinds of signs and symptoms would you suspect if you go to we're going to talk about a in-home care, and they go, hey, this is so-and-so, this is Noah, he gets up from bed a lot, we try and keep him in bed, he's unstable on his feet, and he falls a lot. So what kind of injury patterns would you expect to see on Noah with a history of that?
Bruising?
Skin
Legs
tears,
and knees.
maybe like
Hands, fingers.
All right.
He's got a black eye, big old black eye.
They're strict to stop themselves.
I mean, that could be,
That
if you
could
want to ask
happen.
more.
I ran into a door jam. There's probably a door jam.
So,
involved.
so does a black eye tend to raise a little bit of awareness on some of your assessment and your thought process with Noah here?
Yes.
How about if he just got skin tears on his arms?
Makes sense. It's a fall injuries.
Yeah.
Like wrists?
Wrists, like here, there, yeah?
If they're trying to keep him in bed and that's what's keeping knock shift up, they tend to grab wrists.
Oh yeah, twist injury or fingerprint injuries is what you're thinking?
How about lower extremity stuff, injuries? How about bruising to the back of the legs?
I expect to see it on the buttocks from
Not the front.
How about like right here?
No.
They got big bruises right here on the back of their legs.
If they're not being rolled, like.
Unless
Well,
they
if
get
they're
stuck on
getting
the toilet.
they're
kicked
being
and
left on
hit.
the toilet.
Do you get stuck on the toilet a lot?
Okay?
Yeah.
So, hey, no, hop up here for a second. So Noah's bedridden, remember?
Oh yeah, I remember
I
that.
don't know, did any of you guys see, hop up. Maybe you guys see the hidden camera that the little old man in the care home set up his camera or phone or something like that, set it up hidden for like a week and a half, and he watched the care, and you could see the care providers come in and take care of him, because he was saying, hey, they're abusing me, they're abusing me, they're abusing me, and then everybody's just like, hey, yeah, whatever, and then he got it on his camera and stuff. It was actually like heartbreaking, like watching the way that he was treated. So, normally, Noah gets out of bed, and you can walk him to the bathroom, and he does balls and stuff like that, but is it hard to get bruising on the back of the legs? So if he's bedridden, do they tend to roll people that are bedridden? Right? So we rolled Noah, right? So now what does that do for me and Noah? What does that give me access to?
His back and back of his leg.
Right? So if he's doing something and it just ticks me off and he's doing something with the care providers, how easy is it to just start hitting this direction? Right? So the back, people can fall, get hurt on the back. It happens, right? People fall over backwards. But if you fall over backwards and land on something, it's really hard to get the back of your legs bruised up, right? So anytime you have bruising to the back of the legs, it's big red flags start going off, right? Especially in people that are bedridden, because a lot of times it happens when they get rolled away, and they'll get smacked and they'll get hit while they're being changed, depends being removed, stuff like that. Okay, cool, thanks. Thanks for rolling around. Appreciate it. Provide adequate medical or personal care. What can that entail?
Just like good hygiene.
So people that are bedridden, what do they normally
They
have
need
on?
the diaper change.
Depends, right? So they normally have Depends. And so how long do Depends last?
I mean, are you asking how long until they deteriorate, or like how often you should change them?
How often should you change them?
After every soil.
Every
What happens if they don't use it?
Once
You know, I guess
once
I'll
day?
just leave it on all day. And then,
Are we gonna have to call
No, because
are we
the
gonna have to
last
call
thing-
social
know.
services for Cody?
Be like a pair of underwear then.
Around the legs becomes irritating.
Yeah.
There we go, right?
Basically, it's another form of diaper rash.
Exactly. So they have to change them. And so a lot of people have that thought process of, well, Cody says, like, well, if they're not using it up, we're gonna save some money, we're gonna leave it on, we're not gonna change it. It's a pain in the ass to roll them and move them and get them changed and do all that stuff. But those things have to be changed on a regular basis, because that's exactly what'll happen. That elastic spots will start to create sores. What do those sores breed?
Bacteria.
And what type of infection do they normally get? Staph infection. They get these massive staph infections, and then how deep does that staph infection go? Has anybody been able to ever seen the ones that you can take your whole hand and stick your whole hand inside the sore? For starters, they smell horrific. Like, it's like you walk through the door and you know that there's rotting, decomposing flesh. You're just like, oh.
My brother had that.
Yeah, let's say I've seen like.
It's horrific. Like the smells are like, these are the ones where it's like, these are the greatest moments of Captain history. You're like, oh. I get the paperwork out in the rig, right? Because you know and then what does the firefighters and engineers do? Because they're bedridden? What's the first thing they do? They're like, hey, we're gonna need some help over here moving this, right? It's like, right? So how many people in here can't handle smells? Oh.
Sorry.
There's certain smells like, oh, man, I can handle vomit, but the whole feces thing, feces,
Yeah.
rotting flesh, not me, right? My crew knows that too, and so it's, oh. Vicks only works for so long.
And you don't want to associate that smell with
Right.
that, yeah.
What about if I just simply, you are required, or your doctor gives you those pain meds, right? But I give you one, I keep one. I give you one, I keep one. Can that be considered neglect or abuse?
Yeah.
Can you go to jail for those pain
And a
meds?
drug
Yes.
problem.
Why can you go to jail for their pain meds?
Theft, neglect, abuse.
Reselling it.
Because of the schedule of the medication on top of it increases the trouble that you get in, right? Okay. State of Oregon, gotta call it in. How do we report it?
Elder abuse hotline.
Okay, ring, 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 Friday night, ring, 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 ring.
48 hours.
Okay, Senior Disabled Services, please leave a message, we'll get back to you Monday morning.
We're gonna have to fill out
What do you do
paperwork,
now?
a written.
Leave a message, great, okay, cool.
We have to fill out written paperwork.
There's a form that you can also.
Okay, great, forms getting filled out, but you're at the hospital and you gotta, no, it's NPD, yeah. Oh, you want, oh, ding, and there's Melanie, ding.
Inform the charge.
Okay, so you always go to the charge nurse, right? Dustin always goes to the charge nurse, I've noticed this. Who do you wanna start with, though?
Because he works at the hospital.
First time I've said it.
You said it yesterday, too. Because I remember that, because I remember thinking, I was just like, why are you going to the charge nurse? You gotta start with the nurse that's taking care of the person first. And then, as you're walking back by, then be like, hey, heads up, just so you know, this is what's happened, I reported it to them, da-da-da-da. And then so then you have a double accountability now, right? So now that nurse can be like, hey, I'm gonna talk with the charge nurse. So both those nurses now know that they both know that you've said, hey, this person has got abuse, right? So now they can't say, oh, hey, you didn't tell us, blah, 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 because a lot of people don't want to do, because it's extra paperwork. A lot of people don't want to go through the trouble, which is ridiculous, right? So you guys are going to be way awesomer, and you guys are going to be willing to stay up until like 4 o'clock in the morning doing paperwork to keep somebody safe, right, Cody?
Oh, absolutely.
Like your dedication, okay? So you want to fill out a form. Great. Okay, it's Friday night. You just handed me your form, now what?
Well, we said we're gonna call the police.
Okay, what do you tell them?
I have suspected other abuse at this location. Here's the evidence to show that I prove it. I have already called, and I left a message. I will call again and follow up on Monday. Here's the form that I filled out and I've turned in. I can make a copy for you as well.
Awesome, what do you want us to do?
I mean, I've reported it.
I don't know what I want you to do right now.
Like, fix it. Do it.
Please take it off my plate.
Like, what else do you need from me as far as evidence?
Yeah, so like, what do you need me to do to make sure that this continues?
To get reported.
Yeah, right?
I was like, do you want me to enforce it?
So you call non-emergency.
Yeah, we just call dispatch, yeah. Yep, we'll just call dispatch, let them know. So, let's say that you respond, here's a perfect case. You respond up to Dexter, Pleasant Hill, Lowell area on a call. Who are you gonna report this to? But you transport them to River Bend, and SPD is the people for there.
But
Why
if
can't
they
you just do
live-
both?
Sure.
But if they live out there, you want to get their jurisdiction.
Exactly. So you notify where the abuse takes place. That is the jurisdiction that you notify police-wise. And then so LCSO, 5 hours later, we'll finally figure out whether or not they're gonna.
OSP will show up before then.
Yeah, true. And so and what a lot of times they'll do is they'll notify SPD and have SPD go to the hospital, get a report for them, depending on response times and availability and stuff like that, right? But it goes to the police jurisdiction that the abuse takes place is who you report to. Okay. Oh, here you go. Call to a local senior citizen housing center for an elderly male with trouble breathing. I just gotta tell you, this may or may not be abuse, so don't just jump right to abuse. Psych, haha, here we go, alright? On arrival, 67-year-old male in messy apartment, sitting upright in a chair with rapid respiratory rate and wheezing. Patient can only speak short sentences, states he's having trouble catching his breath. SpO2 is 92%, you apply non-rebreather 15 liters a minute. What do you wanna know?
Does he have a care provider?
No.
Does he have a history of this?
Yes,
What's
he's got COPD.
What does he do for COPD?
Priorities.
What does he do for COPD?
Priorities, airway.
What's his lung sounds?
Well, he's got wheezing.
Oh yeah, you said that. Look at that.
Huh. I feel like sometimes I'm just up here just talking and nothing is being heard. Especially from you, Dustin.
NAB treatment.
What does he?
Well, what have you done to fix this? Have you done,
there's a reason.
take your inhaler or
I
anything?
went twice, didn't help.
Can I check it to see if it's in date and it's
Yeah,
one that's?
Sure.
Does it have medication left in it?
It has, yeah, it's got a little bit left. It's a little outdated, about 2 or 3 months.
Okay.
How long do
When
those
did
things
it
last?
start?
And that's all he does for.
How long do inhalers last?
For a while.
Oh, a year?
Couple of years.
It depends on how often you use it.
And the meds.
Okay, well, I'm just saying expiration date.
Oh.
So this is where you gotta be really careful, because some of them will last like 2 to 3 years. Other ones are very, very short-lived, couple months and you gotta replace them. Insurance companies love those because you just gotta keep buying them over and over and over again, right? Okay, so priority, so we got airway, right? Airway open or closed?
Open. We're talking
Breathing, concerned or not?
concern. We got,
Circulation, concerned or not?
Yeah.
no.
Yes? Do we have anything in our circulation that we can tell at all?
Nope.
Alright, so we don't know if we're concerned yet or not, right? Who asked about if they had a care provider? Jane, I'm not 100% sure. We'll find out, I think. Okay, What do you guys think about those questions?
Well, you said
Yeah.
We've already addressed 1 and 2, right?
the apartment is messy, so someone hasn't been there.
Or does he live alone? Does he?
Well, it's
It
like,
says he lives in a care
it
facility.
said it's a care facility.
Yeah, yeah.
Or it did say care facility.
So what types, so here we go, so what types of care facilities do we have?
Independent living. Independent
We have
living.
independent living, so are those independent livings, are those considered, care homes?
No,
Do they cook their food for them?
no.
Some of them do.
Some of them do.
There's cafeteria for all.
Yeah.
Do they have people that check on them daily?
Mm.
Depends on the level.
So it depends on, I was just gonna say, I was like, well, hold on, we actually have different levels of assisted living.
Once a week.
So like Yapoa is a assisted living apartment type, place, but they don't check on you daily, but yet they have access to your apartment all the time. But yet, some of the, it's either Sheldon Park or Sheldon, whichever the other one is, Sheldon Oaks, one of those is, a independent living that they come and check on you daily. Hey, breakfast is ready, and then that's where it goes. Do they give them their meds? Do they give them any of that stuff? No. Like, you're self-regulating there, right? So there's different levels of care home provider. We're gonna say this one here is, assisted living, they come and check on you daily.
So there should be a
So
little
then
bit more.
Independent living, so they come and check on you daily.
Well, it shouldn't be messy like that.
Do,
There
do
should be a little
those,
bit more upkeep than what is currently not on.
I'm sorry, what kind of messy are you talking about? Because there's like scary death hoarding nest versus like,
You're not gonna disappear into the pile.
okay.
Is it like
So just
trash
live
or is
their
it like
life.
just
Like-
like
The
below?
other thing too with care facilities is, yeah, there's a degree of level of care. Are they just there to do food and meds? Are they actually there to be a housekeeper? I mean, just because the house is messy doesn't mean that the care provider.
Did you say methy?
And most of the time
Most
they,
care providers are messy.
and most of the time they do not clean the rooms.
Yeah.
So they have like basically HOH, things that they agree to sign, but yet they don't go in there and clean their rooms for them. They come in and say, hey, you need to clean this up, or you're gonna be evicted. That can take any long period of time, right? So as mobility goes down, less and less things. Then they end up getting to the point where they will hire out people to clean the rooms, but that costs money. Do a lot of these people have that kind of money?
No.
Not a lot of times. They're all those fixed incomes, okay? We're gonna say that there's old food,
So it's rotting food.
old rotting food left in the sink.
What?
Yeah, there's a bunch of raw chicken and stuff in there. Not his flesh, not his flesh.
Sorry, we got your nephew and there's like the
Okay, so you got rotting, chicken.
Is there a well in the basement?
See, it's no
Dry well?
He is a smoker.
Inside?
No,
They make some white outside.
yeah, he's not bedridden.
Is he not breathing fine?
When was the last time someone-
No, he's still wheezing.
Can we give him a nap?
yeah.
Yeah, I wanna ask these questions.
Everybody okay going with the net here?
Yeah.
Is he,
Does
is
he
he
have
having
any
So I check his heart rate, his heart rate's 220, but hey, we're gonna go ahead and give that a neb.
All right,
Good.
fine,
No,
fine,
no,
fine.
you wanted to give the neb, so now we're going full neb on this, right?
We'll call MD.
Well, I guess
Didn't I
I'm-
just ask the
Yeah, we
question
will
about
call the
circulation?
doctor.
Currently,
Is he
let's
full fail
worry
or
about-
diaphoretic?
Alright, so I'm gonna back you up a little bit, I'm not gonna mess with you that much, but we're gonna get the whole picture before we start doing treatment, right?
But
I like the
we'll,
idea, yes, this person's probably going to get a neb, but you wanna get the whole picture first, right? How long's it going on? OPQ, RST, sample history, all that stuff, you guys haven't got any of that, right?
right.
Alright,
You're probably out.
oh, here's some more information for you. Oh, jeez,
RH100, okay.
heart rate of 100.
We can still do it.
Yeah.
Ping
that's
pong
that's
twice,
Below 160.
cavities are less than 2.
Well, no, Noah asked what his medical history is.
COPD is the only history.
Check pupils.
They're pearl.
Good job, thanks Noah, you did the same thing I did.
It's even bolted.
I appreciate that.
So I'm
So,
gonna go lung sounds because we have wheezing upper, but I wanted to actually know.
Diminished lower.
Does he have a fever?
Fever.
Does he have a fever?
Oh,
Does he have a
That's
fever?
it. Yeah.
No fever.
Oh.
But he's all high.
I hear it there, it comes out
Keep
here.
warm and dry, keep warm and moist, it's great. Cool, now we can give an up treatment.
You wanna give a nep treatment now?
Yeah, heart rate's 100.
Oh, you don't even care what any of those meds in the shoebox are, do you? You're just going straight nep.
What are the?
what are the meds? in the shoe?
Oh, I don't know, I've already forgot, see? Don't give me that look. Don't even.
I was like, if you don't know what they
B.
are. When was the onset?
So, in the box, you find, 12 pill bottles of prednisone that are all empty.
Are they
Are they-
really old or are they all?
They are his medications.
Like today?
Date range is over the last year.
So one a month. And is that date?
Do you know why he's on
by-
steroids?
Does he have-
Intake for that?
Yes,
So,
it does.
Okay, so we save some bottles for here and that bottle at the hospital.
Does he give a current prescription of it, and what's that current bottle?
I wanna know what
It
he's
says
taking
he
it for.
doesn't remember.
COPD.
what he took.
Right, but he doesn't remember what he took today.
Sounds like he needs more care.
What?
Does anyone?
So how
come and
good is
check
he at
on him?
taking his meds beforehand?
Right.
Doesn't sound very good.
We don't
It's not
know.
an issue, right?
So people that have respiratory distress and they get put on prednisone, what's the common prescription for prednisone? What are they supposed to do?
Take their steroid.
It's a daily thing.
It's a daily thing, right? And so what happens if you miss one of your steroids?
Then you're gonna get.
Then you get behind, right?
Yeah.
And then if you miss a second day, so then now you're basically starting over. And then what happens? You run out of your prescription. And so basically, that prescription didn't get done what it needed to get done. And so you're having to start over again. So anytime you see people that are on long-term steroids that have any sort of presentation where they're just like, oh yeah, I'm not really, have a little bit of maybe dementia, beginning Alzheimer's, memory issues. These are the patients where it's like, you know what, this person needs more focused med administration because they're not getting that full dose to get them fully healed. Because it's not normal for people to be on prednisone all the time. It's usually like a 2-week quick fix that builds everything up, they're good to go, and then maybe a couple months down the road, then they end up getting their respirations again, okay? So what does this person need?
They need an advocate.
Advocate, is this person gonna get worse?
Yes.
Failure to thrive.
Can you leave them here?
No.
I don't wanna go.
I'm gonna talk to his provider.
There's no provider.
I thought he lived in a.
They gotta have some kind of.
He just said, so it's one of those assisted living places.
But there's people like a good front desk.
But did you read the whole thing? Let me go back.
Walk your guilt trip path.
He lives alone.
I'm gonna start giving
He's independent living, so.
Okay, so it's independent living. So they're not checking for meds, they just come knock on the door each day and say, hey,
I'm gonna talk to him about, so I assume he's got family. Does he have?
no family. You never assume. Why are most people in a care home?
All right.
Because they don't have family.
Because a lot of times they don't have family, right?
So,
Because,
So who put him in? Did he?
hold on, no, do you have a mom or dad still alive?
Yes.
Okay, so, do you wanna put them in the home or are you gonna help care for them?
I feel like
depends on the day.
So I'm gonna take care of my parents because I'm gonna do everything I can to take care of my parents, right? And so a lot of times, if they have family,
Even your mother-in-law?
no, we are on the brink of eviction.
I've already told my mother-in-law I was gonna pull the plug, so.
Like I'm ready to hook onto the trailer and move that thing, like to Fern Ridge Lake and. And the funny thing is I've told her that too. So I think we're in agreement that things need to change quickly. Things need to change quickly. But anyway, so a lot of times these people, they're gonna if they have family and they have family close, a lot of times they actually are gonna be living with those family members. Okay, if they're in an institution like this or independent living, a lot of times they don't have the family. And so they aren't gonna be like, nope, I don't have anybody, this is the thing, because a lot of times we'll ask these people like, hey, can you get a ride from somebody else? Because a lot of these people don't even need, yes, they need to go to the hospital, but they don't need an ambulance, right? They don't have a neighbor, they don't have friends, they don't have family, they don't have anybody. Lives alone, has no one to care for him. Okay, I don't wanna go to the hospital. Guilt trip algorithm, how does that work? Guilt trips never work.
Annalise is great at it.
Yeah. Well, you start with.
Annalise is good at it?
Mm-hmm.
Okay, get me to go to the hospital.
Sir, I'd like to take you to the hospital.
I don't wanna go,
Why don't you wanna go?
because it costs too much money. I can't afford it. It'll be bankrupt, then I can't afford my meds. Then my family will hate me, because they live in Alaska.
Have you heard of the
Well,
difference?
that's okay, like 90% of people don't pay it anyway, just come take a ride.
And I go, it's embarrassing.
What's the alternative?
You know, it's not embarrassing, we do this every day, I'm really worried, I mean, who's gonna take care of your goldfish if you die here?
I need to go smoke real quick.
Does it have a filter in it?
No, I roll my own.
Oh,
Demonstrates.
organic cigarettes, that's good for the temple. Well, sir, you sound like you're getting worse, and I'm worried that you're close to
I agree.
Very close
I
to
can only do it for so long.
Then we're gonna have to come here again, but we're gonna be shoving the tube down your throat. Alright,
Not going.
You understand that if you stay here, you
Yep,
could
I
die.
do. Crystal clear, I can die, right? Yep, alright, cool.
Okay, I'm gonna ask
Peace.
you 4
See ya.
silly questions.
Yep, my name's Chris, I know where I'm at, this is where I'm going, my date of birth, boom.
Are you ready?
And there, I'm a
Left-handed?
retired paramedic, I used to do this a long time ago.
Oh, yeah.
So why did you call us?
I didn't call you.
Who called us?
The guy who checked on me this morning,
Why did you call us?
he called, he said I was having a hard time breathing.
Wait, you
So he
didn't
abandoned
call?
you?
Huh?
No
So he abandoned
refusal, he didn't call.
Oh, yeah, he just came down.
Alright, we'll call the
No,
company.
refusal.
Yeah, oh, he abandoned me, so, but he doesn't care for me, so that doesn't
He's
matter.
not the caller.
smiled.
Peace out. This was a doctor check, no patient.
We'll have Mons do the full neuro exam on it.
It works every time.
That was
It works
on the
every
left
time. I just give them a little smile and they're like,
How many
I'm
demands
going.
to drink?
That's how Chris does it too.
Yeah.
Keep that for sure.
Oh, jeez. Okay, here we go. Moving on. Okay, so you can see where sometimes these can get to be like they don't want the help a lot of the time, right? They're used to living independent. They have no help already, and so they try and function themselves. Yes, Melanie.
The first slide said he was confused and couldn't remember what medications he had taken, so
Yeah.
would that not be an LC?
I don't know. Ask me every other question under the sun. Let's go.
Who's the president?
Oh, here's a good one for you. So, I had somebody do this.
Why didn't you answer
yesterday.
that question?
Huh? Because they brought up a good point, because I worked with somebody the other day, a new person, that the person refused to answer the question of who the president was.
Oh.
But this little old lady kept saying that son of a bitch president guy was doing this and he's doing that and putting the wall up and stuff like that, and I'm like,
Who else could that be?
she is 100% oriented. And he's going, ma'am, we're gonna have to take you because you can't answer my questions. I'm like,
He's like, he knows.
Wait, really?
She knows exactly.
I'm like, she's more oriented. I mean, she could probably spell it backwards if she really wanted. I'm like, do you even know who the president is? Because I don't think you know who the president is, buddy. So it's that kind of thing. So like, if you don't get that 100% answer, it's like you just kind of go around and you just ask other questions to get that orientation portion of it. All right, so it's Trump. Trump is the president. What else you got? Oh, there's Melanie. Let's remember who was over here that was saying that. Okay, what do you got?
So what meds did you take today?
You know, I had a hard time remembering which meds. I don't know how many I took.
What?
So good enough, like, as in which method?
So if you can't remember what med you took today, then
Hey, my name's Chris. I live at 123 River Ave. This is my birthday. This is my favorite color. What else?
My kids' names are there.
Yeah, I know every other question except I just can't remember what meds.
what day is today?
Oh jeez, you would ask that kind of question. Wednesday.
Today's
We're here early. We're here early today.
Today's Wednesday, do you remember what kind of meds you usually take on Wednesday?
Yeah, I take my respiratory meds.
How much of the respiratory?
Oh, I usually take 1 or 2 pills.
You know what it's called?
No, I'd have to look it up, whatever the doctor gives me.
When was the last time you saw your doctor?
Oh, I gotta see him every month, because I gotta refill my medications. I just sometimes lose track of whether or not I took them or didn't take them. Sometimes I'll double them up, sometimes I'll forget for a day. Yeah, yeah.
You keep a log of your pills, you don't count or anything?
No, I keep them in this, they put them in this Monday through Friday thing, and sometimes,
Who puts it in there for you?
I used to do it every once in a while, somebody will come in, I have a home health care person that comes in every 3 weeks or so.
So you have 3 weeks to a month's worth of pills?
Yeah.
Are they taken appropriately, as in the appropriate pills are missing?
There's a couple days where there's a pill here and a pill there, and there's pills kind of sporadically spaced in there.
So why didn't you take those particular pills on the day?
Oh, I probably just forgot.
How did you forget?
That's got a lot of words per sentence.
Oh, yeah, really.
I did this yesterday.
So did anybody here, Noah picked up on it, did anybody else pick up on
The home health
the
nurse.
home health
comes-
person that comes in every once in a while?
Yeah,
Do you think that person needs to get more involved?
yes.
Do you think that person needs to be notified right now?
Yeah.
Okay, we're gonna give them a phone call. Start me on a neb maybe. Just get on the phone call, be like, hey, we got this person here, he doesn't wanna go, this is what's going on, and try and have them as an advocate. Because do you think that home health person probably knows the person better than we do? Absolutely, right? So those home health people are super resourceful, if you can get a hold of them. Same kind of thing with hospice nurses. Well, hospice nurses are awesome. They're like, nope, don't take them. It's like,
Because if you take them, you kill their hospice.
you know, yeah, that's exactly it. You're like,
Yeah.
you know this person, like, we can fix this. Like, what's going on right now, we can fix this and make this person more comfortable, right? They're like, yeah, no, 1 second. So then we come into this whole like, like the easy fix, DNRs, like DNRs and starting an IV and giving D50. Like, hey, there's fixable things that are there that you'll get put in those kind of situations where you're like, oh man, this is a judgment call. What are we gonna do here,
I
right?
wanna see the little pink form.
So they're on
I wanna
hospice
see
and
the
they're,
little pink form.
they're on hospice with hypoglycemia. And the question is, do we let their hypoglycemia continue to take them down and out?
Right. That type of a thought process, right? So you gotta be
But they're
You
more
gotta be
will
judged.
say, like,
You gotta be
one
judged
thing.
by everyone that's involved with care for that patient, because you're seeing them for this short period of.
Right.
And then who do we always have to go to that will help us make decisions?
The doc.
The doc, right? Boom, we can always throw things to the doctor and help make those decisions, okay? Okay, so finally, you guilted me into going.
Heck,
Good
no,
job.
Goldfish.
It wasn't very smooth, it was the goldfish that really put you over the top there. So what do you wanna do on the way to the hospital? For me. How much sodium Medrol?
1 microgram, 5 milligrams.
Okay. And what?
IVP.
IVP, oh, okay, good. What else? Net sodium Medrol, sats are in the 85s now, 86, or 84. 83. A2.
Squeeze it low.
We'll do the
I got COPD.
the less intense
You can
one.
CPAP. CPAP at 5.
Geez.
We'll do the one without the green machine that just hooks up to the oxygen tank and we'll.
I don't even know,
Green,
nobody
there's
even knows
less
who carries
intensive.
what.
I know you. They're the same thing, aren't they?
Blake, what are you gonna do, dude? You're being really quiet back there. I don't like this quiet Blake
You
approach.
call medical control.
Who does it 15 liters?
Because you can't make your own
CPAP
decisions.
after CPAP, yeah. If CPAP doesn't work, then you call medical control for medical RSI.
Oh, for medical
Also, are
RSI.
you comfortable if your breathing gets worse, would you be comfortable if we were to knock you out with medications and put a tube down your throat to help you breathe?
Oh, that's a horrible idea. I don't wanna do that.
Okay,
Do you want to live?
I love how matter of fact you are.
you said
Yes,
no.
yes, no, maybe, I don't know. Okay, so you're the only one who heard that. Okay, just so you know, you were talking to me, we're in the back of the ambulance, just you and I, boom. Okay, yeah, I don't want a tube put down my throat, no, nothing, I don't want that.
Slide will
Okay,
go up.
boom.
We're not-
No, it's not, it's actually just, you just have the, it's just
Wait, aren't you filming me to check for abuse?
No.
With your little
Not
camera?
my little cam, no.
Little
That-
body
no,
cam?
not at all.
You slide the window
not-
open
it's
and
not
say, hey, can you
recording.
say that a little louder?
But I've already passed out now.
Uh-oh.
I can't speak. Oh, boy. Hey, so just you and I had our little secret there, that I didn't want that too, and now I've stopped breathing.
BB on the shit out of you.
Yeah, back.
Nope.
The shit out.
Adjuncts.
Map or
That's
Blake,
tough.
what's your thought process? I heard, the mustache was kinda, I couldn't read your lips very good because the mustache was.
I want a RSI.
Blake wants RSI, does anybody else want RSI?
You said no, you don't want that
Did
treatment.
the CPAP work?
No, CPAP does not work. You're down in 70s.
They have all sorts of other.
Huh? No DNR.
Don't need it.
Oh,
Okay, so here we are. So we're at one of those moments where you're making that out of the box decision making matrix. This dude just told you he doesn't want a tube.
how far out?
I'm gonna start bagging.
Oh, you are coming from Veneta.
You're calling the doctor.
Start bagging and call the doctor.
Uh-huh.
Yeah.
All by yourself?
You don't-
So,
Documentation.
You have your partner
Because he said so.
just because he said so, right? So if I would have had time to get my partner to listen to it, if my partner would have heard it, but right now I'm the only person that heard it. So right now I start my BLS, I start bagging them, and then I contact medical control and be like, hey, this is what the dude said right beforehand. And they're like, are you sure? Are you willing to justify it? Okay, boom. So you don't do it. They're like, okay, if that's what you want, if you don't want to, if he said that, don't do it. All right, cool? How you gonna document that? Because now, 2.5 years later, the family's coming after you for wrongful death because this person could have been saved, and so how are you gonna approach that?
Patients stated that they did not want a breathing tube down and applied to them.
Very well.
That's just what you said.
Wait, why can't we
Yeah, no
pass the
proof.
blame to the in-home care provider? Sue them, that started weeks ago.
We're not going there. We're back here. You're on the stand.
Well, you're a medical provider, and what you say is, as long as you chart it appropriately, that's what happens.
Oh, I love this. No, take a stand, would you?
Put your hand on the Bible. Hold your hand. Do you promise to tell the truth?
Oh. All right, have a seat. Have a seat.
Can you state your full name?
Can you say your whole name for the record, please, sir?
Noah Peter Lunger,
Longer. L-U. Spell it for me.
L-U-N-G-E-R,
D-R. Okay. And what's your date of birth, sir?
03/05/1998.
Okay, so that makes you 12. Okay. So, Mr. Longer, do you know why you're here today?
Yeah,
Okay. Why are you here today?
because apparently the family is suing me for wrongful death.
Apparently. Okay.
Apparently.
Okay. No, that is the case, sir. That is the case. You are being sued. This is a criminal investigation as well. So, I mean, you understand the consequences of a wrongful death suit, right?
Yes, sir.
Like you potentially killed this person.
Yes.
Wait,
You
You
said I understand the
Well, thank you, sir.
You just
won. Taking him into custody.
You just won his case.
Okay, so I mean, first case. I mean, I knew I
That's a
was.
violation.
You know what? I'm dropping out of school. I'm becoming a lawyer. So.
You asked me if I understand the consequences. I said, yeah.
No, you just said that you killed the person. That's what the jury just heard. So this is your jury right here. Okay.
So,
Objection,
complete sensitive.
Oh, we got. Good thing your lawyer's here. Okay, so. Okay, Noah. So can you explain to me? So you're an EMT, correct? We're gonna say you're a paramedic now.
Well, I was
but-
acting as.
So you are a qualified paramedic now.
That's
I'm giving you
correct.
the cert, so you're there. Okay, you're a paramedic.
Yeah.
All right. So you're an EMT, correct?
I'm a paramedic, sir.
So is there a difference between EMT and paramedic?
Yes.
Okay, can you explain the differences in that for me?
Paramedic acts in an ALS scope, advanced life support, versus EMT acts in a BLS or basic life support scope. Sir.
Yes, no, get it.
So,
What does that mean?
so when you say BLS and basic life support and advanced life support, so does that mean the advanced life support is a higher level?
That is correct.
Okay, can you get higher than an ALS provider?
Yes, out of emergency care. Out of pre-hospital care.
So in the pre-hospital setting, the ALS is the highest level care available to the patient.
That is
There's no level higher that my client, the plaintiff, could have gotten.
Unless a doctor was brought to the scene, that is correct.
Okay.
Or a nurse.
And Ms. Longer, do you have access to a doctor?
I do, yes.
Okay. And what type of access is that?
We have phone contact.
Okay. And so on the date of blah 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 blah, did you contact any doctors?
I did, yeah. I
Okay.
sent-
And which doctor was this?
Dr. Polson?
Dr. Paulson, okay. And what was the conversation that you had with Dr. Paulson about?
So our patient had, his SpO2 sats were dropping, and so I was bagging the patient and we were talking to,
So I'm going to interrupt you there, sir. So you were bagging, so you had already put the patient in the body bag? Is that correct, sir?
we were pushing air into his lungs using a breathing device.
Okay. So you were breathing for the person?
That's correct.
Okay. And then this SpO2 thing, is that bad? Is that good?
The level of oxygen saturation in his blood was not life-supporting.
Okay. And so tell me why exactly you did not do, so what would a normal, highly educated paramedic do for a patient that wasn't breathing well?
Normally,